Hi, my name is Dr. Joe Childs, and on this DVD today, we're going to talk to you about balance disorders, vertigo, and dizziness. If you're a senior, I want you to know that falls are the leading cause of accidental death in patients over age 65. And vertigo is the third biggest reason why people actually seek out medical attention. Vertigo, balance disorders, dizziness, lightheadedness, these types of conditions have challenged doctors for years. They've frustrated patients for years. And the reason why is there's multiple causes for these problems. And there's not very many good treatments out there. In fact, most of the medications that are given only work for the short term, and most of them have the ability to cause you to actually get worse over time. So what I want to talk to you about today on this video is a revolutionary, drug-free approach to treating patients with balance disorders, vertigo, lightheadedness, these types of things. Let me tell you a little bit about my qualifications. I'm a chiropractor. I've been in practice in Downingtown, Pennsylvania for 10 years. But I'm not only a chiropractor, I'm also a specialist in functional neurology. What that basically means is I not only treat the bones of the vertebral column, but I also treat the brain and central nervous system. And I do that using a drug-free approach. So we don't use any medications and we don't do surgery in our office. But we treat the brain and nervous system, and we help patients with these types of issues, balance disorders, vertigo, these types of problems. So what I want to do today is I want to sort of break this up into 4 parts. The first thing I want to talk to you about is the different types of balance disorders, the different types of vertigo that are out there, because there's a lot of them. There's a whole laundry list. The other thing I want to talk to you about is I want to talk to you about the cause of these problems, the hard causes versus the soft causes. I'll explain that. Then from there I want to talk to you about the functional neurological exam that we do in our office for these types of patients when they come in. And then lastly, I'd like to talk to you about the exact procedures that we do to help patients with these types of problems. And again, these are drug-free procedures. It's not just another medication. So let's start off with some of the different types of vertigo. Well, first off, you have, everybody's heard of it, you have vertigo. And you can have vertigo with spinning, you can have vertigo without spinning. We'll talk about that. Number 2, you have ataxia. Ataxia is sort of a clumsiness. It's like you have 2 left feet. You really just don't know where you are in space. Then you have what's called disequilibrium. Disequilibrium basically means that your balance is off. These types of patients that have this, when they walk down the hallway, they may veer to one side, they may bump into things, they certainly are not sure of themselves. When they get out of the car, let's say at the grocery store, it is a feat to get from the car to the grocery store. And if you have this problem, you know what I'm talking about. We see a lot of patients with these types of issues. Then you have visual vertigo. Visual vertigo is interesting because most of the time you feel pretty well, with the exception of when you walk into this large space. And when you walk into this large space, you instantly get this spinning, or you get this strange sort of queasiness feeling about you. Another one would be height vertigo. You go to look over a balcony at a hotel and you just almost get sick. Then you have car sickness. These types of people, they get in a car, they have any trip in a car really just affects their stomach, affects them. They may get nauseous, they may get some spinning, things like that. Another big one that we see in our office is Meniere's disease. Now, Meniere's disease is a problem with the inner ear. We're going to use this chart as we go along. But basically, it has been thought of as an autoimmune disease that creates some damage in the way the inner ear membrane functions, and it can cause dizziness. I mean, these patients get sometimes vertigo for 2-3 days. That really knocks them out, can cause them to be nauseous. It causes them to get some ringing in their ear, which is called tinnitus. They may also have some hearing loss, and usually they have those 3 things. Again, it's thought of that this is an autoimmune condition of the inner ear that brings this about. Then you have the sort of the vague complaint of dizziness or lightheadedness. Maybe you stand up too fast and you get lightheadedness. That's called orthostatic hypotension. With patients that just say they just don't feel right. They can't put their finger on it. They may turn their head real fast and their vision may get blurry. We just call that dizziness or lightheadedness. Again, there's so many of these. We're just going over a few. And then you have something called BPPV, which is called benign paroxysmal positional vertigo. And with this type of problem, basically what happens is you get these little ear rocks, or these otoconia debris, that sort of break off in your inner ear and float around in what's called the endolymph. And what it does is it irritates the membrane in there, which then sends signals into your vestibular system. So it's an inner ear problem. And basically what happens, and see if this sounds familiar, you roll over in bed and you feel dizzy for about 15 seconds, and I mean, it's real bad. Some people get nausea, and then it goes away. Or you're sweeping the sidewalk and you turn your head too fast, and bam, it happens. About 15 to 25 seconds and it goes away. Very common. Again, there's really not a big understanding of what causes that. They do know that it's an otoconia debris or this ear rock, but some people believe that it may have an autoimmune influence. So there's multiple causes, and when you look at these causes, you can break them down into hard causes and soft causes. Now, hard causes are actual things that you can see on MRI, things like MS, things like tumor, things like stroke, things like high blood pressure that's unchecked. These are hard causes that are causing these problems. Now, if you have vertigo, you have dizziness, I recommend that you get consultation and some testing done by a neurologist. Everybody with these types of problems that don't seem to go away, you should definitely get an MRI, get a CAT scan to find out if there's any of these hard lesions. But on the other side of the coin, a huge majority of these patients have what's called a soft lesion. We're going to talk about what a soft lesion is, but let me explain how it kind of goes. Basically, patients with soft lesions, they will go to their doctor. They may go to 3 or 4 doctors. They may get MRIs. They may get CAT scans. They may get some advanced vestibular testing where basically they get some warm water and cold water put in their ear to determine and see if it's an inner ear problem. And here is the frustrating part. Most of these tests come back normal. They come back, nothing's wrong. We cannot find the problem. They'll say it must be a central-based problem, which means a problem with the brain, but guess what? We can't see it. We can't find it. So you start really thinking that you're going crazy because nobody has an answer for you. People tend to think that you're making the problem up. They don't listen to you anymore. Or you go get some testing done and they find out, hey, you do have BPPV, which is benign paroxysmal positional vertigo, which basically means you got a little crystal floating around in your inner ear. They find that out, but the way they treat you is with medication. They give you meclizine or they give you an antivert, which is the same drug, and it works when you're taking it, but when you're not taking it, guess what? The problem comes back. It's basically like a sedative for your vestibular system. Vestibular meaning inner ear and cerebellum, that area. We're going to talk about that today on this DVD. So that's what happens. And the trouble is you still have the problem. So you have an inner ear problem, or you have a central problem, or you have a hard lesion. Okay, so basically this is where I come in. I come in when you go to your doctor and they can't figure out the reason. And they can't tell you why you have the problem, but you feel this way. Your balance is off. Because this is the key. Balance disorders, vertigo, they simply are not just an inner ear problem, and most of the time they're not due to a hard cause. They're not due to the tumor, the stroke, the thing that's really bad that you need to get medical treatment for. So this is basically where I come in. So what normally gives you good balance or good equilibrium? Well, it's a complex interaction between a couple things. Let's look at this poster. Basically, what allows you to have good equilibrium or to feel like you are centered or not dizzy is, again, a complex interaction between your inner ear. The inner ear tells you where your head is in space. If you move your ear right, left, anything like that. The visual system, your ability to see, okay? These things have to match up. If you turn your head to the right, your inner ear tells your brain that you're turning your head to the right. But is what you are seeing moving to the right? Does it match? We call that gain. The other thing is our muscle and joint feedback system. The information coming from our body tells us where we are in space. I'll give you an example. If you take your finger and you try to touch your nose with your eyes closed, you are using your muscle and joint feedback system. It's called proprioception. You know where you are in space. You close your eyes, you move your arm all around, you know where you are. You move your feet a little bit, you know where you are in space because there's constant input from these mechanical receptors that are in your joints. The biggest amount of these receptors are in the spine, and they reside in the discs and they reside in the ligaments. And so if you've got healthy ligaments and healthy muscle and joint feedback system, this information comes in perfectly. The other thing are your feet. If you have peripheral neuropathies or if you have numbness and tingling in your feet from either maybe a disc problem in your lower back or diabetes or things like that, that can certainly affect your balance. So what all these things do is they all communicate in together. and they have to calibrate. They have to match up. If they match up, meaning the information coming from your eyes, your inner ear, and your muscle and joint feedback system are all saying the same thing, you've got good balance. You don't have vertigo, you've got good steadiness, you feel good, you're probably not watching this tape. However, if they do not match up, meaning something's not right with the inner ear, something's not right with the visual system, something's not right with the joint muscle feedback system, then you have a problem. Now, the two biggest causes, or three biggest causes that I know of patients that have these problems that are soft lesions, not hard lesions, is a functional problem in either the cerebellum. The cerebellum is the back part of the brain. It controls balance, it controls coordinated movement, it also controls all of your spinal postural muscles. This area is very important to balance. It's essential to balance. Most patients with balance problems and vertigo have a problem with the cerebellum. Very important. Or they have a problem with the cortex, either the left or right side of the cortex. You can see right in this poster, left hemisphere or right hemisphere. Or they have a problem with their brainstem. And what I mean by a problem, again, it's not a hard lesion, it's not a stroke, it's not a tumor, it's not things like that. It's an area where this part of the body is not functioning as good. The cerebellum may have an area where the left side of the cerebellum is firing really well, but the right side of the cerebellum isn't firing well. Nerves send messages, so if one side isn't firing properly, what happens is you get an imbalance. A cerebellum, I always tell patients, is kind of like a top. When you spin it, if it's balanced from side to side, it's going to look very still. It's almost going to look like it's not moving. But if it's a little heavier on one end of the top than the other end, and you spin it, the thing is going to be wobbly. The cerebellum is just like that. Now, normally, how the brain fires is this. The cerebellum fires up to the brain, or the cortex. This is the cortex here. And then the cortex fires down to the brainstem. And so you can have a problem in your right cerebellum that eventually creates a problem in the left cortex, because the right cerebellum fires to left cortex, left cerebellum fires to right cortex. So this is an important thing. Again, it's not just an inner ear problem most of the time. So what these systems are, the brain and the cerebellum, is they are processing stations for the information coming in from your inner ear, the information coming in from your visual system, and the information coming in from your feet and muscle and joints feedback systems, which basically means your spine and all your joints. And so if the information is coming in properly and these systems are working at 100% and they're firing normally, then you've got good balance. If one side of the cerebellum or one side of the brain or the brainstem isn't firing properly, due to, what causes it? Let me explain. Due to physical, chemical, or emotional stress. As we age, the cerebellum loses its function, typically because of inactivity, because the cerebellum is fed by the structural information that comes up through our joint system. So if we have unhealthy joints, instead of having nice, healthy disc spaces in our neck, over years we start to develop thin discs in our neck. Well, the information that comes up to the cerebellum comes from these discs. And so if you have years and years of damage in your spine, let's say you've had a car accident, or you've had poor posture over the years, or you haven't really cared for the joints in your spine over a period of time, the input coming up to that cerebellum is not as good. So this is called arthritis. And one of the biggest, the huge indicator, it's been studied, patients with vestibular problems, vertigo problems, they almost always, and there's a high correlation with those people having neck pain and also having dizziness. Neck pain and dizziness tend to go together. Neck pain and balance disorders go together. It's because the muscle and joint feedback system isn't working well. Well, over time, that physical stress affects the way the cerebellum fires, and it may fire unequally. The cortex, people that have physical or mental stress over time, when you have mental stress, what that does is your body creates cortisol, and cortisol is toxic to the brain, so that can decrease the firing of the brain. And then you've got chemical stress, diabetes, people that have high blood sugars, low blood sugars, poor nutrition. Over time, it can really affect the way the brain functions. And again, physical inactivity is another big thing that we see. So again, we start developing soft lesions. Now, why do we get nausea? Well, the reason why we get nausea is because if one cerebellum is firing more than the other cerebellum, there's an area. See, the cerebellum fires into the brainstem, and in the brainstem there are nuclei. And one of the nuclei in there is called the NTS. The NTS is the nucleus tractus solitarius. The nucleus tractus solitarius fires to an area in the brainstem called the vagus nerve. And what the vagus nerve does is it goes down to your digestive tract. And this is why if somebody is spinning around on, like, let's say a roller coaster or a merry-go-round, when you spin around one way, it fires up one side of the cerebellum, which creates an imbalance. And when you have that imbalance, it fires into the NTS, and it fires with imbalance. And then that fires down to the gut. This is why some people that don't have good cerebellums, they get on a roller coaster, they get on something like that, they may feel sick the rest of the day. So these are the things that we look for. The other thing that we want to look for is we want to look at your feet, because people with balance disorders typically tend not to feel their feet very well. And so we want to look at all the different modalities in your feet. So how do we know if you have this problem? How do we know if one of these systems are not working well? How do we know if your cerebellum is not working well? Well, what we do is we do a functional brain assessment. So what we offer is a drug-free, neurological-based, brain-based approach to helping patients with these types of balance disorders, vertigo and whatnot, that are not caused by anything that you can see on MRI. So if we find out that we have a patient in front of us, they come in, and typically the type of patient that comes in and sees us in the office, they'll say, "I've been everywhere, doc. My MRI's negative, they can't figure it out, but I don't feel good. I spin, I can't walk, my balance is horrible, I have to be on this walker." And so when they come in, what we're going to do is a very thorough consult. We want to look at the MRIs, we want to look at the CAT scans that you've had. We also want to sit down with you and understand how this is affecting your life. We want to do a very thorough neuropathy scan of the feet, which means we're going to test your feet. We're going to see how well you can feel your feet. We are going to do cerebellar testing. So we're going to do different types of neurological testing to find out how the cerebellum is functioning. What do I mean by that? Well, we're going to have you stand with your feet close together with your eyes closed. What that does is it takes away the visual system. That'll tell me how good is the rest of the system, how calibrated is the cerebellum. If you feel like you're swaying or you almost fall to one side, that means you have what's called a positive Romberg's test, which is indicative of typically a cerebellar problem. We'll do something called finger to nose. We'll have you touch your nose. If you go to touch your nose with your eyes closed using the pinky and you miss, or you come in and you have this little shake at the end, it's highly indicative of a cerebellum that's not working the way it needs to work. We may do something called pass pointing, where we have you come up and try to touch your fingers together or out in the front. Do they touch together with your eyes closed, taking away the visual system? We'll do a number of different balance tests. We'll put you on a balance platform. The other thing we'll do is what's called video nystagmoscopy, which we use what's called these real-eyes goggles. And what we do is we put these goggles on, and there's an infrared camera that slides in here. And what we'll do is we'll videotape your eye movements. And basically what will happen is we'll look and see how well your eyes are moving and how well they match up. So we're going to really check this visual system. Not so much as to how well you see, but how well your ocular motor system is working, how well these muscles are moving. So what we'll do is we'll put this on and we'll spin you round and round. When you spin, your eyes should bounce. They should be pushed the opposite way that you spin and then quickly come back again. And so they should do this. Now, if we spin you to the right and your eyes are kind of not doing that, they're kind of just quivering, we know you've got a right cerebellum that's not firing well. We'll also put these on and we'll have you look from one target to another target and see that when you go from one target, does your eye actually stop on that target, or does it overshoot the target and then come back, which is indicative of a cerebellar problem. We can also determine and see if you have decreased frontal lobe firing, which is the front aspect. People that feel like they are spinning, or they feel like they are kind of leaning or tilting to one side, meaning that the world is not spinning so much, they're the one that's moving, they typically have a cortex problem or a mesencephalon problem. And so we can determine that through our testing. We'll do olfactory testing. We'll do what's called optokinetic testing. Optokinetic testing means we're going to actually have you look at some different tapes and see how well your eyes are moving and tracking. That is a cortical test mainly. It's also a cerebellar test, but it's mainly a cortical test. And so we're going to look at you neurologically. We're also going to look at you metabolically to find out exactly what's happening, looking at your blood work and whatnot. I'll talk about that a little bit more when we talk about treatments. We'll do muscle testing. We'll do smell. We'll do what's called pinwheel, which see how well your sensations are working. And so what we're going to do is we're going to determine neurologically why you have the problem. We're going to find the functional reason why you have the problem, because most doctors, medical doctors, are typically only looking for the hard lesion. If you don't have a hard lesion and you don't have a problem with your inner ear, then there's this big gap in the middle. It's a central-based, non-pathological lesion that's causing your problem. And typically what they say is, we don't know what's causing it. It must be a central problem. Take this medication. Learn to live with it. What we're going to do is we're going to tell you what's causing the problem. So what I'd like to do now is talk to you about our treatment program. Okay, treatments. So what are we going to do to treat your balance disorder or your vertigo or your dizziness? Well, first off, I want to let you know that all of the treatments that we're going to do are going to be specific to the areas of your brain that we find are weak, are not functioning well when we do your examination. So we're going to look at the different aspects. We're going to look at the different lobes of your brain, left and right side, frontal lobe, temporal lobe. We're going to look at the cerebellum, different aspects of the cerebellum, the middle of the cerebellum, which controls a lot of balance and coordination. We're going to check your inner ears. We're going to make sure that you don't have BPPV. We're going to see if there's a otoconia debris that's causing your problem, which we call a peripheral problem. We're going to check your spine. We're going to check your muscle and joint feedback system. We want to make sure that your feet are functioning well. And then what we're going to do is we're going to give you specific treatments based on those areas. The whole goal is to develop what we call neuroplasticity. Now, the word neuroplasticity, if you notice, has plastic in it, and plastic means moldable. And basically what that means is that the brain can change. No matter how old you are, the brain is always changing based on the specific stimulations that are given to it. So if we find an area of your brain is weak, let's say the left cerebellum, we'll stimulate the left cerebellum, and we are trying to develop healthy neuroplasticity, which that basically means is we want to get that area stronger, we want to get that area more efficient, we want to develop better synapses in that area. So I always talk about the Charlie Brown Christmas tree, and if you look at it versus a real bushy, healthy Christmas tree, people that have decreased function, it's like their nerves are kind of like the Charlie Brown Christmas tree. They're just not, the electricity is not flowing through those nerves properly. But if we can stimulate them and we get them functioning better, we can develop healthier, bushier synapses and nerve sprouts and healthier neurotransmitters. That's what we want to do if there's an imbalance on one side versus the other. We're going to get that side up to balance it, and that's going to create more balance in your body. It's going to create less vertigo, and that's the goal. So what are we going to do? Well, the brain needs two things. Your brain needs fuel and it needs activation. Fuel is in the form of glucose, which comes from the nutrition in the food in your metabolism, and it also is in the form of oxygen. Oxygen is fuel for your brain. Your brain needs oxygen. That's why if you have a stroke, you cut off the oxygen supply and your brain tissue dies. One thing, before we get into fuel and activation, I talked about how hard lesions like strokes and MS and tumors and things like that are things that can cause dizziness. Well, you should definitely get those things checked out. But let's say you have a stroke, you've had a stroke years ago, and it is maybe the culprit in your dizziness. It doesn't mean that we can't take care of you functionally. It just means that, hey, you need to get that checked out first to find out if you've had that problem. Same thing with MS. Some people have some MS that is undiagnosed, which may be causing some problems also. So what I'm saying is you need to get a thorough neurological exam medically prior to coming in to make sure that if there is a hard lesion, it's taken care of that way. So we can take care of patients with pre-existing hard lesions, or the goal is to find out what type of soft lesion they have. So again, brain needs fuel and it needs stimulation. So the fuel is very important. So we put all of our patients on oxygen therapy. Oxygen therapy, we use this cannula, and what will happen is we'll put them on what's called an oxygen concentrator. And what we'll do is we get them on the oxygen, which is fuel, and we'll provide them with some type of activation. So we may do some left cerebellar exercises, some balance exercises. We may have you do some nonlinear complex movements with that side of your body. We may put you on a UBE, which is like a cycle that you use for your arms. That will stimulate and fire up the brain. So everything that we do here functionally with these patients, with balance disorders, we get them on oxygen. The cerebellum, which controls your balance, is the most oxygen-dependent part of your body. So typically, over the years, people will undergo what's called oxidative phosphorylation, which means that they won't be able to utilize their oxygen as well, and that can cause some of these decreased areas of function in certain parts of your brain. So oxygen is absolutely critical. We want to provide the brain with fuel and activation. The other thing that we may do is we may do specific types of eye exercises. Let's say we find out that the right side of your brain isn't functioning well, we'll have you do eye exercises where you're moving your eyes to the left. We may do some olfactory stim. We may have you smell different smells to fire up weak areas in your brain. We may do something called a caloric. A warm caloric, will actually put warm water in this external ear here, which will heat up the endolymph inside the vestibular system, and that sends a message to that side of the cerebellum. So if you've got a weak left cerebellum, we may do a warm caloric on the left side to stimulate that side. We may do vibration on the left side of your body to stimulate the muscle and joint feedback system. Another great way to stimulate the muscle and joint feedback system is with gentle chiropractic adjustments on the side of your body that's not functioning. So if you've got a bad left cerebellum causing your balance disorder, we want to stimulate the left side of your cerebellum. We can do that using, I know some patients would like to have as gentle of care as possible, so we may use an instrument. This is a very light instrument that's just going to put a little light force stimulation on the left side of the spine, and that will stimulate the left side of the brain, left side of the cerebellum. So that's an important thing that we do. Now, a lot of patients that have dizziness also have neck problems. They may have lower back degeneration, bulging and herniated discs. And so to improve the muscle and joint feedback system, we may use something called non-surgical spinal decompression therapy, which is a slow stretch to the discs in your spine. What it does is it takes a slow stretch and it activates these muscle and joint feedback system, which goes up and feeds the brain and really improves the function of the brain. We'll put patients on oxygen while we do spinal decompression therapy. Another type of therapy that we use with patients with balance disorders is the interactive metronome. Now, the interactive metronome is a computer-based program where you're going to wear these headphones, and what you're going to hear is you're going to hear an auditory reference tune or an auditory reference bean. Cowbell. It's going to sound like a little bing, bing. It's going to sound like that. And what's going to happen is you're going to have to clap or do a gross motor activity with either your feet or with your hands or with your arms to the beat. And what that develops is it develops timing and it develops coordination between all of these systems here. And that can really enhance somebody and help somebody with balance disorder. So patients, especially people that are having a hard time on their feet, we're going to get them doing things that are going to develop the part of their brain that's going to make them more steady. So that's just a couple of the different treatments. There's probably 100 other treatments that we may do specific to your examination. Now, that's the stimulations. Remember, brain needs fuel and activation. Fuel comes in the form of oxygen. We've talked about that. Absolutely critical for patients with balance disorders and vertigo. The other thing is looking at blood panels and determining how you are doing metabolically. So we send out patients for blood sugar tests. We'll look at their blood sugar panels. We'll look at thyroid function. We'll look at adrenal function. We'll do a complete blood count. We sometimes will send patients out for food sensitivity testing and autoimmune testing. We do special tests for autoimmune function, especially for people with Meniere's disease and this recurrent otoconia debris that occurs in the inner ear, because a lot of times that is due to an autoimmune condition that's attacking the area of your brain that causes you to be stable. So some people are highly allergic to things that they're eating. Gluten sensitivities. They may have an autoimmune reaction to different types of foods, egg, milk, things like that. So we want to really rule out all those issues that may be affecting you metabolically. We look at your blood panels through a preventative medicine integrated medicine approach, which means that when we look at your blood panels, we really want to make sure that things are as tight as possible. You may not have diabetes, but you may have what's called insulin resistance. So your blood sugars may be not where they need to be, but they're not defined as diabetes. And that could be causing a problem. This high blood sugars may be causing some neuropathies in your feet. You may have adrenals that aren't functioning well. So we want to get you metabolically as healthy as possible, because that's going to develop good fuel for the nerves, so those nerves can develop healthy neuroplasticity, which is going to create balance in these systems, which is going to get you better. And that's why we help people get better who have been to 7, 8 different doctors, have tried everything, because medicine only treats the pathology, which is the hard lesions, and they only treat the inner ear, BPPV. And they typically, when they do that, they don't do any rehabilitation functionally of the nervous system. So if you're suffering with these types of problems, the balance disorders, the vertigos, and you've been to multiple doctors and nobody has an answer for you, everybody's telling you, you're going to have to learn to live with it, take this medication, and you're serious about finding out about a drug-free solution, call our office at 610-518-3370, and we will do a complimentary balance disorder vertigo consultation to determine if you're somebody we can help in the practice. Thanks a lot for listening, and take care.